Welcome to the Heart Talk, a podcast dedicated to empowering you with the knowledge and habits that keep your heart strong and healthy. In today's fast-paced world, where stress is high, lifestyles are sedentary, and processed foods often replace wholesome meals, heart disease has become one of the world's leading health concerns. And alarmingly, it's affecting younger people more than ever before. Hi, I'm Huma Qureshi, and in this episode, we're joined by a leading physician to help us understand how we can protect our hearts, detect early warning signs, and make choices that ensure a longer, healthier life. Together, we break down the science into simple, actionable steps that you can start today, because a healthier heart means a healthier you. So, doctor, tell me, why are so many people today, younger people, even celebrities, getting heart attacks at just 40? I mean, aren't heart problems for older people?
Yeah. So one of the common reasons why people are having the heart attack so early is obesity, stress, smoking, hypertension, and diabetes in the young population. Another one of the reason is the dietary lifestyle. So previously, we never had fast foods in the previous generation, but now due to availability of Swiggy, Zomato, the fast foods are also available within a small response time. So another reason is there is a condition called hypertrophic cardiomyopathy. So this is a genetic condition. So whenever a person has a strong family history of heart attack or sudden cardiac death in his first degree family member, he should always get himself tested by a 2D echo, simple sonography of the heart, which will detect the condition. And the treatment is simple. There is some medications for it, and the main thing is he has to be avoiding stressful activities which can precipitate a sudden cardiac death in such patients.
So, what are the warning signs that I should never ignore when it comes to my heart? And when should I see a doctor?
So the symptoms are chest discomfort or chest pain, which is usually throbbing in nature. Throbbing means something has been put on your chest, like a boulder or something. Another thing is that chest pain can radiate to the left arm, it can radiate to the jaw, it can also radiate to the neck, and sometimes in the upper part of the abdomen. Other symptoms include shortness of breath, which usually happens on exertion. There could be palpitations, giddiness, or fainting attacks as well. So it is very vital people keep a note of all these symptoms, and whenever such symptoms happen, they have to visit their doctor as soon as possible.
So, talking about that, so what are the most important daily habits that people can adopt to keep their heart healthy and to reduce the risk of heart disease?
So some of the easiest ways include a balanced diet, which is rich in fruits, vegetables, nuts, whole grains, and lean protein. Lean proteins include white protein, that is the white meat, that is the fish and chicken. Regular exercise, which includes moderate activity. Now there are different stages of activity. It could be mild, moderate, or severe. So mild activity is something like a simple walk in which you can easily sing. So moderate activities includes like brisk walking in which you can talk but you cannot sing. And severe physical activity includes something like running, swimming, in which you can't even speak properly. So these are the categories how you differentiate in the mild, moderate, and severe physical activities. So at least 150 minutes per week the person should be doing moderate activity, and there should not be a gap of more than 2 consecutive days in the exercise. If the patient is doing vigorous activity, it can do 75 minutes per week and not a gap of more than 2 days of exercise. Other lifestyle modifications include quitting smoking, reduce alcohol intake, and regularly monitor your body weight, blood pressure, and blood sugars. So there has to be regular screening of people which are in the high risk group. suppose there is a family history of sudden cardiac death, the patient should get evaluated after the age of 30 by simple lipid profile, creatinine, HbA1c, which is a marker for diabetes, normal blood pressure checkup, and some of the lipid profile tests which are specialized, which are usually skipped on the routine examination. Is one thing is lipoprotein A. It is one of the important genetic marker for cardiovascular risk, that is early stroke or heart diseases. So this has to be done at least once in your lifetime, and if it is more, then you have to take precautions and follow the diet which is recommended by your doctor.
How much do diet and physical activity actually affect your heart health, and what are your top recommendations?
Yeah. So about 80% of premature heart diseases in India is preventable with diet and exercise. So one of the important diet which we recommend is DASH diet, which includes lots of fruits, vegetables, white meat, that like fish, chicken, and nuts and legumes. The other thing is, as I said, regular physical activity, which helps in reducing the blood pressure and keeping your sugars under control. People who are diabetic can usually try to have a physical activity, a simple walk at home as well, for at least 10 to 15 minutes after that each meal will help in improving the insulin sensitivity. Again, the cholesterol levels will also be reduced with this level, and also with that, yoga, meditation will also help in reducing the stress and hence for the inflammation in the body, which is one of the important reasons for heart diseases.
What about stress? Does stress actually affect the heart, and what are the practical steps that one can take to reduce it?
Yeah. So like I said, chronic stress is one of the important risk factor for raised blood pressure and also the inflammation in the vessels of the body, and also increases the risk of arrhythmias, which are the abnormal heart rate rhythms. So stress related heart disease is very well documented in young people nowadays because of the heavy work burden of around 12 hours per day stress. Also with that includes the traveling stress and the financial burdens which the people have. So one of the important techniques which one can follow is yoga, meditation, deep breathing, and adequate sleep. Adequate sleep meaning 7 to 8 hours per day, of 7 to 8 hours of sleep per day. So also counseling might help in some people who are chronically stressed. Okay, all in all, so whenever there is a patient who has come to us with chest discomfort, you should always get evaluated by your physician. A simple ECG goes a long way in detecting a cardiovascular health. Along with that, there have been other investigations which are quite non-invasive, like 2D echo, and another new investigation which has come up is CT coronary angiography. With the small contrast and within 15 minutes your status of the blood vessels of your heart is known with this test. So there has been many advances in the investigation, and it is very useful for the doctors as well as the patient to get these investigations done, and it has been available at very cheaper rates as well. Although the CT scan is a new modality, but ECG and 2D echo has been a very simple test in diagnosing cardiac diseases and the structural heart diseases.
Well, as we wrap up today's conversation, remember, your heart's health is in your hands. Every small change you make, from the food you eat, the way you move, and how you manage stress, adds up to a stronger, longer life. We hope the insights have inspired you to take those steps starting today. After all, your heart works for you 24/7. It deserves the same care and commitment from you. Thank you for tuning in. Until next time, keep your heart happy, and it will keep you going strong.